Hey guys, welcome back to Medical Coding with Blue. It is a very soggy Saturday outside. Thank you so much for joining me today. If you're new to my channel, I am an outpatient medical coder. I have over 10 years of experience, and I hope that by sharing all of the information that I know on my channel, it'll help you whether you are a medical coding student or a veteran medical coder. Today, we are talking about the credentials. I get so many questions about the credentials. Which one do I start with? Where do I go? What does this mean? There are so many letters. Trust me, I know. It is very confusing in the beginning, but hopefully with my little chart here, it will help you. I got all of this information from the websites from AHIMA, the American Health Information Management Association, and from AAPC, the American Academy of Professional Coders. These are the two major medical coding association powerhouses, okay? AHIMA has the longest running, and they are very steeped in history. AAPC has many coders as well, and they are both well respected. I do not have a dog in this fight other than I am just a HEMA member, but I always bring you guys AAPC information as well, because I believe that you all should make your own decisions about what path you want to take in medical coding. You can check both of the websites. I will leave them down in the description box below, along with my email address and some other contact information for me. This is not a sponsored video, just so you guys know. They are not paying me. I am just doing my part to educate all of you. All right, so let's go ahead and get started with AHIMA credentials, because this is where I am most familiar. This is where I know the most. All right, AHIMA. So you have 2 degree programs, and AHIMA is the only one. Sorry. Oh, little boys in their cars. It's not even a fancy car either. Anyway, I can say that because I have a sports car, so I can say that, all right? Anyway, getting back to the show. AHIMA is the only one that has the degree programs. So they have, one is a bachelor's, which is the RHIA, Registered Health Information Administrator. And then they have the RHIT, which is the Registered Health Information Technician. That's the associate's degree. So what is the difference between the two? So the RHIA is going to be the people that are in charge. They are going to be on the senior floor. They are going to be on the executive floor. These are the people that make all the decisions. They can run hospitals. They can run large medical facility groups, because they are the brains basically behind the operation. But yes, that is what they do. The RHIT is more, to put it colloquially, is more of the worker bee, okay? So with the RHIT, those are going to be your leaders. Those are going to be the leaders that are taking care of the other coders. They're going to be the auditors. They're going to be just basically the more hands-on staff. Maybe they're going to be trainers as well with the providers or with the other coders. So they are more of the worker bee, okay? The CCS, these are the coding credentials now. Sometimes with the degrees, they will ask you to have an additional coding credential along with it. They won't always do that, but I mean, just so you guys know what it is. So the CCS, or the Certified Coding Specialist, is the gold standard of all of these credentials, okay, when it comes to the coding certifications. So with the CCS, that is the Certified Coding Specialist, this says that you can code both inpatient and outpatient setting, that you understand how to code the CPT, from the CPT manual, the current procedural terminology manual, and you also know how to code PCS, the inpatient surgeries, okay? Now, those are a little bit more involved because you have to build those codes, whereas with the outpatient CPT book, the codes are already there and you're just selecting from that code book for the procedures part. And you also understand like the differences in what you're going to pick up when you are diagnosis coding, okay, in those settings, because the rules for inpatient diagnosis coding are different from the outpatient medical coding rules on the outpatient side. So that's something to keep in mind. So people who have this CCS have both. I mean, they have both, that they're saying that they've mastered both of them, and it is a very good credential to have. The CCSP is a certification for outpatient. It's a certified coding specialist, physician based. This is basically saying that you are very familiar with the outpatient setting, that you can do like outpatient surgery coding, you can do those kinds of things in the outpatient setting. That is primarily what that certification says, okay? The CCA, or the Certified Coding Associate, and I have that one, woo! These are for people who are brand new to the field, who have no previous experience, who have, this is the entry level basically. And it just demonstrates that you know the basic fundamentals, you understand what medical coding is. From what I understand now, some people have said that the CCA does cover inpatient questions. So you are learning about both inpatient and outpatient. So it is a very valuable credential. All of these credentials are very valuable. But I will say this, for the certifications like the CCS, CCSP, CCA, these are 4-hour tests, okay? Whereas AAPC is 5.5 hours, so, or roughly 5.5 hours. Check the websites for more information on that. So that way you guys can see which one you want to go with. And to take and sit for the CCA, and I will plug for the CCA because a lot of people say a lot of things about the CCA. But for all of it, I will say this. This is a 4-hour exam. If you can pass this exam on the first try, you're doing very well. And you could check the first-time pass rates for a CCA. This is a very good credential to have. And there are plenty of job listings for it. So that's all I'm going to say about that. All right. So now let's get into the specialty credentials, okay, for AHIMA. You have the CDIP, which is the Clinical Documentation Improvement Practitioner. Okay. And this is basically saying that they have a knowledge and competent in high quality clinical documentation within patient records. They are the ones that work very closely with the providers and to get them to be more detailed and more specific in their documentation, and just filling in those holes that would sometimes be left open if somebody wasn't trained quite as well, okay? And of course, they're experts in the industry, and they are competent in capturing documentation necessary to fully communicate the patient's health status and conditions. Again, these are the people that are filling in or helping the provider to understand where to fill in those holes and make the documentation more better and more complete. Okay. And yes, I am looking at the AHIMA website right now because my handwriting is like a chicken. I have chicken scratch handwriting. It's true. I'm in a program for it. I'm kidding. But I don't like jotting things down because sometimes I can't even read my own writing. You guys have seen me when I'm trying to read some of my notes. It just gets so bad. And anyway, so that is a very good credential to have if you are interested, if you've had experience. Now, you cannot get this unless you've had some experience or you go through a program. So make sure that, you know, on these additional credentials that you end up getting, that you do have some experience and that you've studied plenty for these, because these are quite difficult, okay? The CHDA is the Certified Health Data Analyst. So you ever hear, like in the hospital, like, oh, they're the data analyst people. Basically, they're taking all of the data that's coming in from what is being coded, and they're looking at trends, and they're looking at what is maybe a condition that is constant in that particular setting or facility. They're looking at those types of things. They are seeing the bigger picture. They are looking at all of the data. And what is it, how is it impacting their facility? So this is a very detailed position, and to know and understand this is really very very important, because that data can go a long way. Okay. The CHPS, which is the Certified Healthcare Privacy and Security. Now, of course, we all know privacy and security is extremely important. But when you have like this credential, it says denotes competence in designing, implementing, and administering comprehensive privacy and security protection programs in all types of healthcare organizations, demonstrates a choice to focus and advance by specializing in the privacy and security dimensions of the HIM, and shows a commitment to advancing privacy and security management practices and lifelong learning and professional development. So again, this is highly specialized, and usually this person is going to be working strictly with like privacy and security. Okay, so those are all of the HEMA credentials that I'm talking about today. They are very, I mean, all of these are very valuable. But as you get more credentials behind your name, remember that you are going to have to get continuing education units, and this is with both AHIMA and AAPC. And when you have to get those continuing education units, they do get expensive. I'm just letting you guys know. They do get expensive to be able to maintain, and keep in mind you still have to pay your maintenance fees if you're a member of the associations. And I think with AAPC they require you to be a member, so that's something else you got to keep in mind. Okay, but you know, it's a privilege to be a medical coder, and in order to maintain it, you got to pay. So, all right, now we are talking about AAPC. So I'm going to start out with the CPCA. Now, before I will just explain this. The CPC is the credential with AAPC. Now, it has a -A when you first get it. You have to have a certain amount of hours of work completed, and you have to get a letter and something like that. Or you could go through what they have is called Practicode in order to remove that A. So you have to have a certain number of hours that you've worked, or you have to do Practicode in order to get that A removed. And that A just means apprentice. That's all it means. And it's basically saying that you're a brand new medical coder, and that you have very limited or no experience just yet. Okay, so nothing wrong with it, but having that A designation is going to let the people know that you are brand new. Okay. And the next one, so the CPC basically covers like your understanding of like outpatient coding. It's mostly outpatient coding. They do have some surgical background, like it's part of the program that they study for surgeries, to code surgeries and things like that. So that's basically what it is. It is the entry level. It is considered their entry level. They do not, like I said, have the degree programs. That is only with AHIMA. And so CPC is basically a person who's just starting out, or they are a medical coder, and they're demonstrating their understanding of like just basic fundamentals of medical coding. Okay, it is a very good credential. Lots of people have it. And sometimes that's the only credential that they carry. So, I mean, it's okay. And then the next one is a COC, which is formerly the CPCH. It's a Certified Outpatient Coder. This is somebody that is very familiar with just the outpatient setting when it comes to being a medical coder. There's a difference between understanding the outpatient side and the inpatient side. And as I've said, the rules for diagnosis coding is completely different from outpatient to inpatient. So this is why they have these separate designations for that. So they have this COC, and then they have this CIC, which is a Certified Inpatient Coder. Again, they are very familiar, and they've mastered the inpatient coding setting, you know. So that is what that credential is for. And then you have the CRC, which, let me bring it up here. The CRC is a Certified Risk Adjustment Coder. So they has proven by rigorous examination and experience that they know how to read a medical chart and assign the correct diagnosis, the ICD-10 codes, for a variety of clinical cases and services for risk adjustment models. The I can never say it. Like, it's hierarchy, but I can never, hierarchical, whatever. You guys know. Hierarchy, condition. I just completely butchered that word. Categories, the HCCs, and the Chronic Illness and Disability Payment System, the CDPS, and the U.S. Department of Health and Human Services, the HHS Risk Adjustment. So basically, these are very, very detailed coders when it comes to like these higher risk patients who have like diabetes and heart disease and oncology. Those things are much more detailed in coding. So they know and understand, and basically it's the saying that they can demonstrate that. So that is what that credential is for. Okay. Now for these specialty ones, the CPB, which is the Certified Professional Biller. Now I will say this. You do not have to be certified to be a medical biller if you are going to apply at a medical billing company. Most times they will have you just have to have a high school diploma or a GED. Okay, that is mostly what they're looking for when you are applying for a biller position. Now, if you own your own company and you want to run your own business as a medical biller, that would be something to have. That CPB would be very good to have, because this says that you've demonstrated your understanding of these different insurance companies and what they have, and with their rules and things like that, and you know how to follow the rules. But again, if you are just looking to add on, consider what you're adding on before you add it on. Okay, you can sit for different credential exams, yes. You can eventually have an alphabet after your name, yes, but consider what you are getting. And again, if you have your own private business and you want to get the CPB because that's what you do medical billing, then salute, that's good for you. That would work. That makes sense, okay? But if you're just trying to rack up a bunch of different credentials, just make sure that you're doing it for a purpose and not just for show. Okay, does that make sense? I hope it makes sense. All right, so the next one is, where did it go? Come on. The CPMA, which is the Certified Professional Medical Auditor. So this is a person that is very detailed. They know all the rules, they understand, and they check the audits for denials when maybe an insurance company is denying you. The CPMA is the one that goes over there and says, okay, let me look it over and let me see what happens. Let me see what I can see, okay? They also do a lot of the internal audits for wherever they're working as well, because they're trained. That is what they do. They're trained and they've got that keen eye. So that is what a CPMA is. All right. The CDEO, which is the Certified Documentation Expert Outpatient. Sort of like, it's sort of like a CDIP, right? Certified Documentation Improvement Practitioner. Certified Documentation Improvement Practitioner from AHIMA. So AAPC sort of has the equivalent with the CDEO, which is that Certified Documentation Expert Outpatient. They are the ones that are looking for the holes in the documentation. They're the ones that are looking to get this documentation to improve, okay? Now, you may hear me a lot of times when I say you got to develop these relationships with your providers, and that I do this. You don't necessarily have to have this designation in order to do this. I do it, but again, I got stuff going on in the back. I'm working on. I'm working on it. But this is something that all coders should try to do. They should try to look for the holes. They should try to better themselves in order to make sure that the provider can benefit. Okay. And then yes, after a while, if you want to get these additional credentials, go for it. But yes, that is similar to AHIMA's credential. Okay. Now, the CPCO is the Certified Professional Compliance Officer. They're the ones that's really looking at more like the legal side of the house. They're the ones that know like the government regulations and things like that, and they follow the rules and they follow the guidelines and things. And with the Affordable Care Act, you know, they're the ones that are really making sure that everything is compliant, okay? That is a very important position to have, of course, because that can make it where you're not having so many denials, or make it to where everything is compliant as possible. Okay. Again, very, very important to understand those laws, but you can still do that without having to have that credential. But if you have that credential, it is a good feather in your cap. Okay. And then finally, the CPPM, which is the Certified Physician Practice Manager. Now, this is a really good one. I think this one's kind of cool because this one says that you've had so much experience as a coder that now you can run a physician practice. Okay, you can run your own office, and you know and understand the big picture. You can you know ins and outs of everything, of the billing, of maybe you're not necessarily doing the billing, but you understand. Okay, you understand the coding most of all. You understand the money side of the house. You understand the staffing side of the house. This is basically saying that you've done so much that you can say with quite certainty that you have this physician practice manager, in the bag. You can be the boss. So that is basically what that means, and that is my very very plain as I can get it explanation of all of these credentials. Okay, again, I know that this is a lot, and after a while you will learn these. They will start to make more sense to you, and and as you get into the field, try to start with one. If you are just starting out, start with one credential. That way you can know and decide if you really like it. And if you really like it, then keep going for it. Keep going for it, and just keep doing your thing. Some people go their entire careers only with one credential. Some go with an entire alphabet. So it's going to really depend on you. If you want to be a member of one association, that's fine. Some people are members of both associations. But as I've explained, there's equivalent credentials in both associations. So, I mean, it's really putting out more money. Sometimes your facility will pay for it, which is a good thing. And if they pay for it, then by all means, get all the education that you can out of them. Because I am a strong advocate for people, getting educated for as little money as possible, because, education is so expensive. And so, like I said, if you can get as educated as you can for as little as you can, then you're doing really good. So, but yes, I hope this has cleared it up. And if you guys have any questions, please let me know. I will leave the links for both associations down in the description box below. If this video has helped you, I hope that you will share it, because if we can share this message of medical coding and this craziness that is the HIM field, the Health Information Management field, it is a good thing, okay? Because there's not a lot of us out there, and a lot of times we have to learn things on our own as medical coders. So I'm just here trying to help folks out. So anyway, I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.